Montana Pediatrics project was entitled Responding to the Need for Increased Healthcare Services for Children. Our clinical scholars fellows included Dr. Chelsea Bodner, Dr. Monica Taylor Desir, and Dr. Michael Hasselberg. Our community partners were HPDP, the HPDP School-Based Health Clinics, ResCast, and Erica Berry, a rural nurse practitioner. The goals of our project were to empower families who've been left behind in the leap to telemedicine and support communities with fewer providers and resources towards sustaining the rural workforce into the future by creating culturally appropriate and easy to understand training materials. We initially set out to create our training materials to be heavy in teaching technology, how to use the tools for telemedicine. We started out by doing a 5-day trip to Fort Peck to engage, listen, set project goals, and talk to them about what we were going to do. During that trip, we realized that teaching technology could not come first. We needed to first establish relationships, establish trust, explain who we are, what we do, and how technology could help. Following that trip, we reset our goal for the project, and we saw a direct increase in telemedicine visits by 115%. And that has continued month to month since that initial trip. We created training videos, a video library, and a technology manual specific to the rural use of telemedicine and designed to be culturally and educationally appropriate for Fort Peck. This now will serve as our template for expansion and replication to the next community. We interviewed and captured rural providers' inputs along the way on our project, and we began the planning process for replicating this to other communities. What were the outcomes we noted? We saw improved understanding of who we are, what we do, and how telemedicine works, and thus an increase in trust in us. Increased equitable access to healthcare was noted, and there was an increased continuity of care and support for community providers. What were the important lessons we learned along the way? Always involve community members early. How you do something can be more important than what you do. Take the time needed to create reciprocally beneficial relationships based on trust. Our project could not have moved forward if we had not backed up and taken that step. The value of understanding the long-lasting impacts of trauma is extremely important when working in Native American communities and rural communities, as impacts of trauma go back generations. This was important for our project. We also learned that simplicity often leads to better outcomes. And lastly, when invited into a community, let the community lead the project to support a sustainable and replicable model. Thank you.